And the entire insurance industry is totally broken in conjunction with healthcare. The healthcare system in the United States is broken. Every single one of you listening to me right now is nodding along because it is just a broken marketplace. It makes no sense the way we have designed it. It is the most inefficient and the least effective part of, I would argue, the American economic system. It is anti-capitalistic in many ways. It is profoundly broken. This spending package that the Democrats are insisting on continuing would add up over the next decade, according to the Wall Street Journal editorial page, to around $450 billion. And much of it is a subsidy that is, in a large extent, unnecessary. And so let me give you a little bit of a background of exactly what's going on, try to simplify this for you. So we begin with the foundational point that the healthcare system in this country is broken, and anybody who's ever had to get on the phone with their insurance provider knows exactly what I'm talking about. Studies suggest that one reason our healthcare system is broken, probably the primary one, is nobody has any idea what anything costs. And so you can't make a rational decision in your life about whether or not you need an MRI or whether you need need to go to the hospital or not, because a lot of times you don't have the information, as you're not a doctor, as necessary. And what has happened is doctors wildly overprescribe because much of this is paid for by insurance, and patients, to a large extent, are not making choices that are rational. I'll give you an example that happened recently in my family. I think it was a few years ago. My wife was in a car accident. She was fine. She was able to get to the hospital and make sure everything was okay without needing an ambulance. But the ambulance, the police officer told her, hey, the ambulance can take you, but it will end up costing you thousands and thousands of dollars, or you can take yourself to the hospital on your own. How many people actually make that choice? How many people actually, in much of your life, and I've talked about this in my own life when it came to having our kids, we went to go tour the hospitals. Nobody could tell me what a delivery cost. Went to all these different hospitals. They're competing to see who has the fastest Wi-Fi. They're competing to see who has bamboo floors, who has the best flat screen televisions in the delivery area, what sort of security there is to make sure that your babies are safe. All those things are fine. They don't compete on price. I just said to each of them, hey, what's this going to cost me? None of them could tell me. I mentioned to you, I think last week, because I think it's a really instructive analogy, that I went and took one of our kids when he had strep throat. My wife took the other one. She was on the ball, knew where our health care card was, knew exactly who our health care provider was, turned it over when she checked in. I didn't have any idea where the health care card was. Somehow I couldn't find it in my wallet. I think we had switched. And my incompetence meant that we were billed as not having health care, and we paid a fraction of what my wife paid for the exact same medical treatment because we had health insurance. It's all broken. All of it is broken. And I could get on a pedestal and talk about this forever. The fact that we run healthcare as someone who has owned a business and has had to pay for healthcare, the fact that healthcare is connected to employment is crazy. I have been a freelancer who was not an employee. And the fact that I had to go out into the healthcare marketplace and figure out what policy was the right one for me was incredibly complicated too. Insurance is the only thing all of us have to pay for that we hope to never use. And the entire insurance industry is totally broken in conjunction with healthcare. We spend way more than any country in the world, and we do not get the best results. And the data reflects that you could eliminate half of all medical treatments, and there wouldn't be any change in life expectancy in this country. So my general proposition is I don't want to take anything. I know Tylenol was in the news. I get made fun of. I don't want to take any drugs. I don't want to take anything. I feel fortunate. I've been pretty healthy in the grand scheme of things. And I think that they wildly overprescribe and over-medicate us as a whole. And yet, simultaneously, the people who actually do need health care, the people who are actually sick, the people who are in desperate need of health care cannot get it. And the people who don't need it don't feel like we're getting any kind of rational health care that makes common sense. Okay, so that's where we really are. First time I heard the stat, it didn't make a lot of sense, but when you dig into the details, unfortunately, it's very true. Across our country, a home burglary happens every 30 seconds on average. That's a reminder to have the right tools to protect yourself and your family, and you can get them from our sponsor, Sabre, spelled S-A-B-R-E. Website, sabreradio.com. Sabre is the company we trust to provide our families with the best non-lethal self-protection tools. If Sabre makes it, it's inside the Travis home. Their pepper gel projectile launcher, shaped like a pistol or a rifle, depending on the model, fires off a pepper gel projectile. Targeted, goes a longer distance than you might think, making it effective against an intruder. Sabre is also the #1 pepper spray trusted by law enforcement. You can set yourself up with Sabre self-protection tools today by going online to sabreradio.com. You'll save 15% there, S-A-B-R-E radio.com. You can also call 844-824-SAFE. That's 844-824-SAFE.